Hello and welcome to another video. In this video I'm going to cover the muscles of the upper arm, the lower arm, and the hand. So to start, the muscles of the arm are traditionally divided into two groups. You have the anterior compartment and the posterior compartment. The anterior compartment consists of three muscles: the coracoid muscle, which is going to sit here. It arises from the coracoid process and inserts at the corpus humeri. And the function of this muscle is to flex the upper arm and abduct the arm, as you see here. Abduct the arm and flex the arm. All right, and the next one is a large muscle consists of two heads called musculus biceps brachii. So the two parts are long head and the short head. The long head is gonna arise from the tuberculum, the supraglenoid tuberculum, as you see here, and it's gonna go through pass through the cavity of the shoulder joint and then occupy the intertubercle groove. And then the short head is gonna sit directly on the coracoid process, and then the belly of the two heads are gonna fuse and have a common insertion point, which is gonna be the tuberositas radii. And the function of this muscle is actually to flex the lower arm and also supinatio antebrachiii, meaning to twist the arm to the side, and also abduct the arm to the side. I'm gonna show you it here. This is pronatio, pulling the arm back to the original point, and flex the arm and flex the lower arm. So now go over to musculus brachialis. Musculus brachialis is gonna sit right under musculus bicepsus. It's gonna sit here. This is musculus brachialis. It originates from the humerus, or the lower part of the humerus, and it's insert also at the it's gonna insert at the tuberositas ulna. Here it is. And the function of this muscle is actually only flexing the lower arm. And then we go over to the posterior compartment. On the posterior compartment, you will see the triceps. It's a really big muscle that occupies the entire posterior compartment. This muscle has three heads: the long, lateral, and medial head. The long head sits on the tuberositas infraglenodala on the scapula, as you see here, and the lateral and medial head are going to sit on the corpus of the humerus. The lateral head, so let's see if I can kind of show you it. Let's go ahead and start the nerves. Here you go. This nerve is called the radial nerve, and the lateral head is going to sit above the radial nerve, and the medial head is going to sit underneath the radial nerve. All right, we can remove the nerves, and this muscle, or those three heads, are going to have common insertion point, which is going to be the olecranon of the ulna. And the function of this muscle is to extend the antebrachiii, or extend the lower arm, and also extend the arm backwards, and also adduct the arm, pulling it to the midline. And then you have musculus Anconeus. Musculus Anconeus, actually that's easier to just search for it. It's going to be here, musculus Anconeus. Let's see if I can. Here's the muscle. And musculus Anconeus is going to originate from the lateral epicondyle of the humerus and insert at the epiphysis proximalis of the ulna. And the function of this is actually to extend the lower arm, as you see here. It extended backwards like this. All right, so now we can go over to the muscles of the forearm. The muscles of the forearm, I've divided them into anterior, lateral, and posterior groups. We can start with the anterior group in that one. So the anterior group of muscles of the forearm consists of 4 layers. On the first layer, you'll have 4 muscles that you can see here: first, second, third, and fourth. The first muscle is musculus pronator teres. Musculus pronator teres is actually all 4 muscles going to have the same origin points, which is going to be the epicondyle medialis. And this muscle, pronator teres, is also going to originate here and insert at the fascias posterior and lateral of the radius. You can isolate it so you can see it better. And the function of this muscle is actually on the name pronator. It pronates the arm, pulling the radius towards the to the side. And then the next muscle is musculus flexor carpi radialis. Musculus flexor carpi radialis inserts at the epicondyle medialis and the fascia antebrachii. And this muscle is going to insert at the basis osis metacarpi of the second and third metacarpal. And the function of this muscle is to flex the hand and abduct the manus to the side. And then the next one is musculus palmaris longus. Musculus palmaris longus also inserts at the epicondylus medialis and originates from epicondylus medialis, and inserts at the aponeurosis palmaris. That's going to be a tendon sheet. Let's see if I can bring it up. Here you see it, the tendon sheet on the hand. So I'm going to remove them again. And this muscle is actually only responsible to flex the hand forward. And then next one is the flexor carpi ulnaris. Flexor carpi ulnaris has several insertion points or origin points. It originates from the epicondylus medialis and also the olecranum. Sorry, it's a wrong muscle. I meant to click on this one. Go ahead and isolate that. You will see it here. Originates from the olecranum and the lateral, the margo posterior of the ulna, and it inserts at os pisiforme. Let's see if we can get it here. Inserts at the os pisiforme. There's a bone on the wrist, and also the hamatum and the fifth metacarpal bone. I don't think it's shown in this program, but that's mostly how it's inserted. And the function of this muscle is actually to flex the manus and also adduct the manus, pulling it to the midline. And then if we go over to the second layer, we have musculus flexor digitorum superficialis. Musculus flexor digitorum superficialis. Let's see if we can highlight here. Here it is. Go ahead and isolate that. Here is the muscle. It inserts at the epicondyle medialis humeri and then inserts at the phalanges mediala of the second to the fifth finger. And the function of this muscle is to flex the phalanges media and phalanges proximal and the manus. Kind of makes the bye-bye sign. That's the muscle that's responsible for that. And then we go over to the third layer, which is going to be the musculus flexor digitorum profundus. It's going to lie right underneath the superficialis. And this muscle extends all the way to the phalanges distalis also. Let's see if I can highlight it here. Flexor profundus, here we go. Here is the muscle. And the profundus is going to originate at the anterior surface of the ulna and the membrana interosea. And then again insert at the phalanges distalis, so the second to fifth finger. And this muscle is going to be responsible of flexing the phalanges distalis, medialis, proximalis, and the whole hand, the manus. So now we go, and then next muscle is flexor pollicis longus. Flexor pollicis longus. Pollicis means thumb. So every time you see pollicis, that's going to be related to the thumb. So let's go ahead and insert on that one as well. It's easier. Flexor Pollicis longus, this one here. Flexor pollicis longus is gonna arise from the anterior surface of the radius and the membrana interosea, and then gonna insert at the phalanges distalis of the pollicis, of the thumb. And the function of this muscle is also in the name, flexor. It flexes the thumb, making it, I can show you it on this program as well, I guess. Here, it flexes the thumb, as this muscle can be responsible for. And then the fourth layer is going to be musculus pronator quadratus. Musculus pronator quadratus is here. It's a short muscle that lies between the ulna and radius. It arises from the anterior surface of the ulna, you see here, and then inserts at the anterior surface of the radius. And the function of this muscle is also in the name, pronator. It pronates the arm, pulling the radius to the side so that the dorsal surface of the hand faces forward. So now when we cover the anterior muscles of the forearm, go over to the lateral muscles of the forearm. There's gonna be 3 muscles. The first muscle is musculus brachioradialis. Musculus brachioradialis is gonna arise from the margo lateralis humeri, as you see here. It's the lateral margin of the humeri, and then insert at the processus styloideus of the radius back here. And this muscle is going to be responsible for flexing the lower arm, and also going to be responsible for the pronatio and supinatio movements. So the next muscle in our group is going to be the extensor carpi radialis longus and brevis. This is here you see the extensor carpi radialis longus. This muscle is going to arise from the epicondyle lateralis of the humerus, and it's going to insert at the second metacarpal bone. And then you have the, let's see if you can highlight it here, that's the extensor carpi radialis brevis. This muscle is going to also arise from the epicondyle lateralis of the humeri and sit on the third metacarpal, so the long head. So the long head sits on the second metacarpal bone, and the short head sits on the third metacarpal bone. And both of them are going to have the same function, which is going to be extensio manus. They're going to extend the manus, or the hand, backwards, and also abduct it to the side. Alright, so now we're done with the lateral muscles of the forearm. We'll go over to the posterior muscles of the forearm. That's going to be also divided into 2 groups, the first layer and the second layer. Okay, here's the posterior group. So the first muscle is extensor digitorum. Extensor digitorum is here, and it's quite a big muscle. It arises from the epicondyle lateralis of the humeri, as you see here, and it's also going to insert at the phalanges media and phalanges distalis of the 2nd to 5th fingers. This muscle going to be responsible for extending the fingers and the hand, pulling it backwards. So the next muscle in our group, let's look at our list again. That's going to be the extensor digiti minimi. Extensor digiti minimi is going to sit on the little finger. That's what digiti minimi means. That means little finger. Let's see if we can also search for that one. It's going to extensor. Here you see extensor digiti minimi. It's going to have a small muscle back here. It's hard to highlight it. Extensor digiti minimi is going to also sit at the epicondyle, or the lateral epicondyle of the humerus, and it's going to sit on the medial and distal phalanges of the little finger. And the function of this muscle is to extend it backwards. Send the little finger backwards. All right, and then the next muscle in our list is the musculus extensor carpi ulna. Musculus extensor carpi ulna is this muscle right here, and this muscle is actually gonna originate from the epicondyle lateral humeri and also the olecranon. It's not shown here, but it's also gonna originate from the olecranon and the fasces posterior of the ulna, and insert at the fifth metacarpal bone, as you see here. That's the fifth metacarpal bone. And the function of this muscle is the same as others. Extend the manus backwards, pull the hand backwards, also abduct the hand, adduct the hand, pulling it towards the midline. And then if we go over to the second layer, we have 5 muscles I'm gonna cover. The 5 muscles, let's see if we can highlight them. The abductor pollicis longus. Let's go ahead and search for that one. Abductor pollicis longus of the right hand. Here it is. The abductor pollicis longus originate from the posterior surface of the ulna and radi, and also originate from the membrana interoseus, and it inserts at the first metacarpal bone. That's why, remember, pollicis means thumb. And then you have the extensor pollicis brevis. Extensor pollicis brevis, as you see here. So also gonna search for that one. Just replace abductor with extensor. Here it is, the right one. It's gonna be this one. And this muscle is gonna also arise from the posterior surface of the radius and the membrana interossea, and it's gonna insert at the proximal phalanges of the thumb. And the function of this muscle is to extend the phalanges backwards. The thumb is gonna extend it backwards. And forgot to mention the function of the pollicis longus. That's going to be the abduction of the thumb, as in the name. So, and then the third muscle, extensor pollicis longus. Extensor pollicis longus, you can kind of imagine the function of this one as well. Let's go ahead and search for it. Extensor pollicis longus, right, here we go. This is the one. Extensor pollicis longus is going to sit also on the posterior surface of the ulna. Remember, the extensor pollicis brevis sat here on the radius. This one sits on the ulna, and also at the membrana interossea. And you're going to insert at the distal pollicis, distal phalanges of the pollicis here. And this muscle is going to extend the pollicis backwards. And then we have the extensor indicis. It's going to be the finger you use to point with. Let's go ahead and search for that one as well. Extensor indicis. Here it is. This muscle is going to originate at the posterior surface of the ulna and the membrana interossea, and it's going to insert at the base of the phalanges of the media and the distal one, this finger number 2, and it's going to be responsible for extending the muscle backwards. And then the last muscle of the first layer of the posterior part of the underarm is the lower arm, is the supinator, musculus supinator. Musculus supinator is going to sit a bit up. Let's go ahead and search on that one. Here it is. Musculus supinator is, the function of this muscle is actually in the name as well. It originates at the epicondyle lateralis, as you see here, and at the ulna, as you see here. And its function, and it inserts at the lateral at the lateral surface of the radius. And the function of this one is a supinatio of the antebrachium, meaning pulling the hand back to its normal position. We can show it in this video. So this is abduction. Here's the adduction. It pulls the hand back to its normal position. So now that was the muscles of the forearm. Now moving over to the muscles of the hand, which is also going to be the last muscles group of this video. Let's go ahead and go over here. There we go. And activate all the muscles. There we go. So the muscles of the hand are divided into 3 groups. You have the muscles of the thumb and muscles of the little finger, Digiti Minimi, and the muscles of the middle group of the hand muscles. So let's start with the muscles of the thumb. And also note that the muscles of the thumb and muscles of the little finger have 3 of the same muscles, just the opposite. Yeah, they both have abductor, flexor, and opponent. Abductor, flexor, and opponent. All right. So if we start with the thumb, here is the first muscle, abductor pollicis brevis, as you see here. And this muscle is gonna arise from this ligament right here called retinaculum flexorum. And it's also going to originate from the scapulovideum bone of the wrist and insert at the proximal phalanges of the thumb. And the function of this muscle is in the name, abductor. It abducts the thumb to the side, as you see here. This one, but here you see, abducts it to the side. And then the next muscle is flexor pollicis brevis. Flexor pollicis brevis is here, and this muscle flexes the thumb. It originates from this tendon right here called retinaculum flexorum. Again, you'll notice that most of the muscles of the hand arises from this tendon. This muscle actually has 2 heads, forgot to mention. The first, the caput superficialis, sits on this tendon, and caput profundum sits on 2 of the carpal bones called os trapezium and os trapezoideum. And they both insert at the proximal phalanges of the thumb. And as mentioned, they flex the thumb. And then the third muscle is opponens pollicis. It's going to sit underneath the abductor pollicis. Let's go ahead and hide this one. Here it is, the opponens pollicis. Opponens pollicis also going to arise from this tendon, the retinaculum flexorum, and the trapezium bone. And this muscle is going to insert at the base of the metacarpal one. And the function of this is oppositio pollicis. I'm going to show you this movement. This movement is to pull the thumb and little finger together. Here you see the opposite, the same muscle just for the little finger. So now the last muscle of the thumb is abductor pollicis. Abductor pollicis is going to sit, let's go ahead and search for that one as well. Abductor pollicis is here. That one. It has 2 heads. It has a oblique head and a transverse head. The oblique head sits on the os capitatum. It's a bone on the wrist, and the transverse head sits on the third metacarpal bone. And they both have a common insertion point, which is going to be the phalanges proximalis of the thumb. And the function of these muscles is in the name as well. It adducts the arm, pulling it towards the midline. I kind of show you it here as well. Here you see, here it is, adduction. All right. So now going over to the little finger. The little finger has abductor digiti minimi, the same as the muscle for the thumb. And this muscle originates from the os pisiforme, from the bone from the wrist, and also this tendon right here called retinaculum flexorum, and it inserts at the base of the proximal digiti minimi. This muscle abducts the arm, the little finger, pulling it to the side. And then we have the flexor digiti minimi brevis. Let's see if we can find that one. Flexor digiti minimi brevis of the hand. This muscle originates from the hamatum bone and the retinaculum flexorum, again, this tendon, and it inserts at the proximal phalanges. And the function of this muscle is to flex the digiti minimi, flex it forward. I can show you it here, flexing it forward. This muscle is only going to flex the little finger, but yeah, you get the idea. And then we have the opponent's digiti minimi. Let's see if I can highlight it here. It's not this one. Nope. Opponents of the digiti minimi. Here it is. This one is gonna originate from the hamatum bone of the wrist and also the retinaculum flexorum, this tendon again, and it's gonna insert at the metacarpal of the little finger, of fifth little finger. And again, the same movement as I showed you is gonna be responsible for pulling the little finger and the thumb together. Oh, this movement is called apotio. And then we have palmaris brevis, musculus palmaris brevis. Musculus palmaris brevis is that one, and it's going to originate from, again, this tendon right here. It's called retinaculum flexorum, and also the aponeurosis palmaris. Let's go ahead and let's see if I can show it. Here it is, this one. It's going to originate from these two tendons, and then insert at the skin of the palm of the ulnar side back here. Alright, and the function of this muscle is actually to produce wrinkles of the skin on this side, and also tenses this aponeurosis palmaris. When it contracts, it tenses this muscle. So now we have covered the thumb and little finger. Now we're going to cover the middle, the muscles of the middle group of the hand. Let's go ahead and hide this sheet here. The first muscle I want to cover is the lumbrical muscles. The lumbrical muscles, let's see if I can highlight them here. There they are. Those are the lumbrical muscles. You have 4 lumbrical muscles on your hand, and they originate from the digitorum profundus tendons. Remember I talked about a muscle here called flexor digitorum profundus. This is the tendons of it. It's gonna, let's see if I can highlight it from here. Here, tendons of, yeah, at the tendon, at the flexor, musculus flexor digitorum profundus tendons, at least. And then they're going to insert at the proximal phalanges of the 2nd to the 5th finger. You see here, 2nd to the 5th finger. And here's the tendon. And then the function of this is to flex the phalanges proximalis. It's kind of hard to explain, but it flexes this muscle while extending the other muscles, the other bones, so that you'll be able to bend your hands. You can bend these two forward, but this one can go back. So the next muscle is musculus interossei palmaris. Musculus interossei palmaris. Let's see if I can. Here they are. Musculus interossei palmaris originates from the metacarpal bones of the 2nd, 4th, and 5th, and insert at the proximal phalanges of the 2nd, 4th, and 5th. And the function of this muscle is to abduct the digitorum to the sides, pulling the 2nd, 4th, and 5th fingers to the 3rd one. And it adducts, pulling all these 3 fingers to the 3rd finger. And then the last muscle I'm going to cover in this video is the interossei dorsalis, musculus interossei dorsala. Here they are. The musculus interosseous dorsale originates from between the metacarpal bones of first to fifth finger and inserts at the phalanx proximal of the second to the fourth finger. And the function of this muscles is to abduct the digitorum, pulling the second and fourth finger away from the third. I can maybe show you on this one. Here you see pulling the second and fourth finger away from the third. And third doesn't move at all. You can try it yourself actually, and keep an eye on the third finger; it won't move at all. All right, and that was the muscle. That was a video about the muscles of the arm, and I hope this was helpful.